Hi everybody, Dr. Sylvestre here. I've posted all these videos on YouTube on why I created all the different workshops that I have created. So I just think it's time I tell you why I am not creating a virtual workshop on TPLOs. When I create a workshop, whether it be virtual or hands-on, there's some criteria that I consider before choosing the topic. One, the procedure I'm talking about has to be practical, commonly enough used in a private practice setting that you have a chance of getting good at it, doing enough of it, and getting comfortable with that procedure. Or it needs to be maybe a life-saving procedure. For instance, the perineal urethrostomy. You may not ever do very many of those, but when the time comes, it's just good to have the information at hand, to have taken the workshop and know that you can go back to those videos anytime, refresh your memory, and then go do the surgery. The other criteria is maybe it's a limb sparing procedure. So the FHO would be a good example of that. Maybe there is a fracture or a luxation that can't be reduced, and rather than amputating the leg, you are going to do an FHO. Much better solution, in my opinion. The other criteria that I look at is that the surgical procedure has a reasonable learning curve and preferably just uses some of the basic surgical skills that we've all learned in vet school and that you continue to use on a daily basis in your practice. The reasonable learning curve ensures that odds are good that you're going to have successful outcomes after learning a new procedure. These are the criteria I tend to keep in mind. So now let's look at the TPLO specifically and why I will never create an online workshop. Also a little dubious about a hands-on workshop with the TPLO, for me personally. The TPLO certainly, is practical. You tend to see a fair number of cases that could use a TPLO in your general practice, so that is not a concern. It's definitely not a limb-sparing or life-saving procedure. Nobody should lose their life or lose a limb because of a torn cruciate ligament. There's always exceptions to the rules. I won't argue with that, but in general, cruciate ligaments do not warrant euthanasia or amputation. Now, the TPLO does require having more than just the basic surgical skills. You need some basic orthopedic surgical skills, understanding of how to use a drill, how to choose implants, how to bend plates, how to insert the screws, as well as some of the stresses that are applied to bones and how to work with them when you're dealing with an orthopedic surgical case. So that's just a little bit beyond basics. Of course, that can all be taught in a course. However, it just means if you know none of this and you take an online TPLO course or any TPLO course, firstly, you need to learn that. And if you don't know that, it just adds to the new information you're getting in a short period of time. So odds are pretty good you're going to miss out on a few other things, right? You know that we can only put so many things on our brain at one time. The other thing about the TPLO is that it requires a lot more precision than many of our surgical procedures. And precision is something, the more precise you need to be in surgery, the more likely things are to go awry. You need to practice more and get a better feel for it to be able to consistently get those little maneuvers that might all require a little bit of precision to get them just right. So the cut has to be right, the rotation has to be right, the angulation has to be right, the bend in the plate has to be right. It's a lot more difficult to show you with a video how to decide if your angle is right. It's easier to show you. It's easier to have you feel something because then you're more likely to get that, oh, I get it, I understand it, that aha moment that we teachers all love to hear. That's why when taking a TPLO workshop, it's really, in my opinion, important that you have an experienced person with you to show you, to direct you, to guide you, to show you how to think as you're doing the surgery and to show you where the mistakes are. That's why the online TPLO is a really bad idea. I'm not talking about just discussing it, that's fine, but actually learning how to do the technique. Go take a hands-on course, and better still, take several hands-on courses. I'm going to tell you in another video how to choose a good surgical course for something like a TPLO, even an extra cap. But for now, I want to keep on talking about the online TPLO course. The other thing about the TPLO that adds to how much you need to learn is that you really have to be able to read your pre and post-op radiographs well. In order to do that, you need to be comfortable with reading radiographs relating to the stifle, relating to the angles. You also need to learn how to look at a radiograph for the implants, how they're positioned, are they loosening, how is the bone healing. Oh my God, the number of times I get post-op TPLO radiographs sent to me, they're 8 weeks post-op, and the veterinarian wants to know if the bone is healed enough for them to take the plate off. That's something that if you're doing TPLOs, you really should be able to assess how the bone is healing, because it's all part of doing a TPLO. When you are doing a procedure, when you learn a new procedure, it's not about just learning how to do the surgery. It's about knowing how to manage the case, because you're it. If you're doing the TPLO, you're doing the pre, the intra, and all the post-operative care. So it all comes together, and you need to know a lot of detail. But what makes it being a dynamic repair more important, and therefore take a moment and think about what you're doing before you decide that you're going to be doing TPLOs or TTAs or CBLOs, any of these dynamic repairs, is that you are changing the joint. You are changing the anatomy. If things go awry, if things don't go well, you can't go back. So another criteria that's important to me is if we're doing an elective procedure, if I am teaching a procedure which I consider elective, cranial cruciate repair, luxating patella repair, these are electives. The dogs can live with the issue that they're having. It'd be nice to fix them, but they can live with it. They can be managed somehow, right? If you are doing an elective procedure, man, you don't want your patient to be worse if things don't go well. You at least want to come back to the starting point, the 0 point, right? So the extracapsular repair, it's a passive repair. Or a static repair. We just take everything, we hold it all in place until the scar tissue can get there, and that's it. And if things don't go well, you're back to a dog with a cruciate deficient stifle. You're not in a worse place, or the dog is not in a worse place than where he was. So just a few things to keep in mind if you're thinking of taking a TPLO course. Not that I think general practitioners shouldn't be doing TPLOs. That is not what I'm saying. I know many that do an excellent job, but it's not for everybody. So just because you think it might be a good idea because you're sending a lot of these cases away, you may want to think again. A better course for doing cruciate repair would be an extracapsular repair. Yes, the lateral fibular suture technique, because doesn't require as much precision. It's a lot more forgiving. From that point of view, it's a much easier procedure. And yes, I actually think it's a very good procedure as long as you know and understand case selection. I hope you found this to be helpful. I will put another video out there on how to select a good workshop, a good hands-on workshop, if you do want to go and learn how to do a TPLO, kind of how to be successful by going out and taking a TPLO course.